Hello everyone. In this video, we are going to discuss about impulse control disorders. Impulse control disorders is a condition in which a person has trouble controlling emotions or behaviors. Often the behaviors violate the rights of others or conflict with societal norms and the law. The DSM-4 formally recognizes pathological gambling, kleptomania, trichotillomania, pyromania, and intermittent explosive disorders as impulse control disorders. So we'll discuss one by one. First, we'll discuss about intermittent explosive disorder. So definition is the violent impulses. Intermittent explosive disorders can be difficult to identify, so because it is often confused with bad temper or behavior. So these are the common causes: too much testosterone level, childhood exposure to illegal substances, head trauma, seizure, brain infections, grown up with unstable family, no role model in early life, low self-esteem, insecurity. These are the common causes for this disease condition. And the symptoms are can last 10 to 20 minutes, repeated unpredictable episodes, no sign of aggression between episodes, injuries and destruction of property. This kind of behavior will be there, and irritable, increased anger, rage, and tingling chest tightness, headache. These are the common symptoms for explosive disorder. And the treatment and the therapies are cognitive behavior therapy we can administer, and medications such as antidepressants, anticonvulsants, anti-anxiety agents, mood regulators we can administer for this condition. Next, we'll discuss about kleptomania. So kleptomania is a inability to resist the urge to steal things, although the items they steal have no personal gain. It is quite rare, and it should not be confused with shoplifting. So typically, without regard for need or the profit, people will steal things. So causes are possible genetic component, depression, mood disorders, obsessive compulsive disorder are often present as well. Most cases occurs in females. Large amounts of stress can trigger an episode. These are the common causes, and the symptoms are urge to steal things, increased tension leading up to theft, pleasure while stealing, guilt and shame afterwards, uncomfortably anxious and tense, spontaneous episodes will be there, and things like arguments can trigger an episode. Can show a fetish. Fetish means stealing the same kind of things. And the treatments therapies are medications, mood stabilizers, benzodiazepines, and seizure medications we can administer, and psychotherapy such as cognitive behavior therapy, covert sensitization, and aversion therapy, systematic desensitization we can administer for this. Next, we'll discuss about pathology. So definition is uncontrollable access to gamble. So this pathological gambling, it destroys relationships, it causes financial problems, can cause problems with the law, and especially so those who have this pathological gambling disease condition, so they cannot stop this behavior. It's very difficult to stop this kind of behavior, and it is also known as compulsive gambling or disordered gambling. The common causes are highly competitive mind, problems with the brain serotonin, norepinephrine, and dopamine level, and believe they have control over the situation, which relieves their stress, may have a genetic component, and majority of cases of pathological gambling occur in white males. And symptoms like can be more serious during stress or depression, and preoccupied with gambling and getting money, taking time from work or family, feel remorse afterwards, borrow or steal money from friends or the family, or the lying. These are the common symptoms for this condition. And treatments and the therapies are medications includes antidepressants, mood stabilizers, and narcotic antagonists, and psychotherapy. especially cognitive behavior therapy and group therapy, we can administer for pathological gambling behavior. And then we'll discuss about pyromania. So definition of pyromania is uncontrollable impulse to set fires is repeatedly with no motive. It is a serious mental health condition. The causes are feel repressed by authority but seeks attention, may have been neglected, and stressful events can trigger an episode, can have bad social skills and poor relationship. So these are the common causes for pyromania, and symptoms like deliberate fire setting. So more than one episode, intense attraction to fire, tension or excitement prior to incident, and pressure or relief after or when setting fire. These are the common symptoms. And treatment or the therapies are treatment is not found to work very well, and medication serotonin reuptake inhibitors we can use for this condition, and psychotherapy behavior modification we can administer. And next we'll discuss about trichotillomania. Trichotillomania definition is an uncontrollable desire to pluck hair from their body. So this can be the hair on their head, and it also can include the eyebrows, eyelashes, and other body hair. So this can result in complete hair loss. Causes mutation in a gene and childhood abuse, including sexual, physical, or emotional, and maybe a learned disorder. Stressful situations could trigger an episode. And symptoms like patchy or bald areas, and chewing or eating or playing with the pulled out hair, and rubbing pulled out hair across lips or face. It can be intentional or unintentional. So treatments or the therapies are medications, antidepressant medication we can administer, and psychotherapy, cognitive behavior therapy or acceptance and commitment therapy we can administer to correct this condition. So still now we have discussed about intermittent explosive disorder, kleptomania, pathological gambling, and pyromania, trichotillomania. Hope you got little idea about impulse control disorders. Thank you.